My next patient's name is Claudia, and she's from Arizona. She's here to talk about facial rejuvenation and seek out some attention on what can possibly be done to make her look more youthful around the face and neck area. Hi, Claudia.
Hi.
Michael Epstein.
Nice
How
to
are
meet you. I'm nervous. I'm fine. I'm excited. Really, I just wanted to talk to you about what you thought,
Okay.
what you would recommend.
For the most part, though, the biggest thing that's bugging you is what's going on around the mouth and maybe the lower portion of the face.
I forgot this guy here.
The face and the neck.
Yeah,
Okay.
Here.
All right.
Yeah.
Have you ever had anything done before?
I've had a little Botox,
Okay.
and I had a little Restylane.
Okay. But no surgery?
No.
Okay. And how old are you?
You mean on my face?
On your face, yes.
No,
on your
no
face,
surgery
yes.
on my face. I
On
will.
your face.
You know, I'm embarrassed to say. I was thinking about that last night. I can't remember if I'm 61 or 62.
Okay. Well, you're in your low 60s, and that's
I'm in
all
my
that
low
matters.
60s.
And you're healthy?
I'm healthy.
Okay. There are some things that you can do to sort of slow down the aging process, and there are some surgical things that we can do to reverse some of the things that have already taken place.
Okay.
Okay? And when we think about facial aging, the three things that you want to keep in mind that are really occurring from birth are that we lose volume in our face, we lose elasticity in the skin and the soft tissues, and then we're subjected to gravity. What we want to do is do something to resurface the skin to get rid of some of those little tiny lines by actually erasing, taking off the epidermis, okay, and allowing it to regrow because there's been a buildup of some of that sort of cornified or dead skin layers. And then we also want to stimulate new collagen and elastin to grow underneath. And that's going to be done with fractionated CO2, okay, and that's a special laser that's going to bore little tiny microscopic holes in the skin to stimulate new collagen and elastin and get it to grow and thicken up the skin nicely, okay?
Okay.
And then as far as the rest of you goes, fortunately, your skin, you don't really have a lot of gravitational problems, okay? You don't have big time, jowling. You have a little bit here, I would say mild jowling and a little bit of laxity to the skin on the neck. But I think you would benefit from a little bit of a skin lift without you having to undergo a full-blown facelift, where I'm dissecting the skin all the way across to the nasolabial fold, lifting up some of the soft tissues. The recovery process for this will be a lot quicker, okay? The outside incisions are very similar. Your scars are going to be up in the hairline in here, interdigitate between the hair follicles, and then come around in front of the ear, and you can see you have a little crease right here. That's how fine the scar is, and that's where it's going to be located, and then wrap right around behind the earlobe, underneath it, and then back behind here so you can't even see it. You can see it's going to take some of the jowling away, sweep this upward a little bit, and get rid of some little bit of extra skin. That's it.
Yeah, I see. I got some extra,
Yeah.
and then that pulls this up.
What's really erasing the lines is going to be the combination of all three things: the volume replacement, the resurfacing of the skin with the laser, and the sweeping up of the skin anti-gravity work with the facelift. You do have a lot of redundant skin of the upper lids, and I think just by taking some extra skin of the upper lids, we can clean up that upper lid, eyebrow sort of interface there. But I would not do a brow lift, which is good.
Okay.
That's less surgery.
Okay.
An eyelid lift, or is just removal of some extra skin and a little bit of fatty tissue right in the lid crease. The surgery itself will probably take me about 2.5 to 3 hours.
And then these stitches, when do they come out?
Stitches will come out in a week.
A week.
Yeah.
Okay.
So I'll be seeing you in that first week several times.
Okay.
Take the initial dressing off, take some eyelid sutures out, take the final facial sutures out around the ears, and then after that we start spreading out our appointments. Yeah. Okay?
Alrighty.
Do you think you have a good understanding of what we're talking about?
I do.
It's a pleasure meeting you and
Nice to
seeing
meet
you.
Thank
And
you.
I will be seeing you soon, okay?
Okay.
We're going to mark the areas that we're going to operate on, okay?
Okay.
Because everything changes when you're laying down and you're sleeping, and so we want to be able to demarcate some of the areas where you're missing some fullness, because when you lay back, that's not going to be seen.
Okay.
Then I mark the incisions where they lie when you're upright too. We'll get you a nice warm blanket.
Warm blanket? Yes, Joe. can see here is, we like to keep the number in the 60s. And at that point, you know the patient's unconscious.
As we know, the aging process is really a combination of gravitational changes, loss of elasticity, and volume depletion. And so what we're going to be doing is we're going to add volume where volume has been lost. We're going to use your own fat to replace that volume. The first thing I'm going to do is go ahead and get our fat. You can see nicely, this is after centrifugation, and you've got basically, there's 3 layers. There's the great fat cells in the middle. There's a lot of the oil which we're going to take off, and we're going to, you'll see we can just undo this, and a lot of that fluid just drips down right to the bottom, and so we get really just some high quality fat cells that we're going to use instead of filler, which doesn't last. This is really going to last essentially forever. Start at the upper lids. Normally, if I was doing a little bit of liposuction under the chin with a more traditional facelift, I might start there. We're going to get a nice elevation there because she's thin. The weight of her tissues is not heavy, and she doesn't need a lot more than this. One of the hardest parts of this is just realigning the hairline back up, so that, again, you can't tell if somebody's had something done once the scar heals. Of all the 3 or 4 different operations we're doing here today on Claudia, fat grafting, it's really probably the most traumatic, just because of the needle trauma. This is completely typical. You're only 2 days after your surgery, not even really a full 2 days, and we're going to replace this with a smaller dressing, and you're going to see that it's going to look, the swelling is going to come down pretty fast over the next few days, okay? In fact, you can even see a ridge where the dressing is pushing in your forehead, so I know that that's partly the dressing that's causing all this swelling. You can see how, look at, how you got the little dots all over. That's from the laser, okay? And those are going to fall off. You're going to see in the next few days, okay? All that sort of brownish cast skin is going to just kind of slough off. Well, it's almost 2 weeks after your surgery, and how do you think you look?
Great.
I think you look pretty darn good also. You're still, I'm sure you're well aware, you've got some bruising here, and that's not going to be there forever. A little bruising in the lips and underneath the eyes. Mm-hmm. I can see some little bit of bruising tracking down into the neck, but that's going to all go away probably within the next week. Okay. Your incision lines are a little red, but they look like they're doing great.
Should they be red?
They should.
Okay.
They should be red. They're not angry red like an infection or anything like that. They're appropriately red from the healing process, and they might get a little bit more angry in between the 4 to 6 week period after surgery.
Okay.
And then they'll really settle down, and within 2-3 months they'll be barely noticeable. Okay?
I've noticed a big difference in the last couple of days, just in the tightness here. That it's not as,
Good. Yeah. It does feel pretty tight initially.
Yeah, it feels great. I mean, it's.
But you look terrific. I know you're heading back to Arizona, right?
Tomorrow morning.
All right. Terrific. You were a terrific patient. Take care, and I'm glad we could help you.
My expectations have been met beyond. For the first time in a few years, when I put my makeup on, my skin isn't looking crepey. And also, I don't have a chicken neck anymore. So now when I look, I don't have this double thing happening here, which is incredibly exciting. And then this whole jawline here is fabulous. So I'm thrilled. And I'm also thrilled to begin to see as time goes on, because I keep being told that, it's going to be a few months, and this is only, 8 or 9 days into it, and it's going to be a few months, and I'll continue to see changes. In regards to recovery afterwards, I didn't really have any true expectations of what I was going to look like. And I was warned that I'm not going to look so pretty. I'm going to look pretty bad. But nothing prepares you for looking like a monster. And I definitely looked like a monster. It was kind of scary. It is scary. I will say that there was no pain, which was, I guess I probably expected to be a lot more uncomfortable than I was, but I was not. So pleasantly surprised on all of that. And as far as the healing process, I would say that the surgery was done on a Tuesday. I would say by Friday, I began to see the swelling begin to go down so that I wasn't quite as scary a monster. And then by a week from the day that I had the surgery, my son picked me up to bring me to get stitches out, and he said, "Oh my God, Mom, I can't believe it. You don't even look like you had surgery." And now here it is, maybe 10 days, 9 days since surgery, and I think I can walk down the street and nobody would guess that I had surgery, except my lips are still black and blue. I'm thrilled. I'm very happy. I think he's fabulous. And I'm going to have all my friends from Arizona come here now.